want to start off by talking about the touchscreen monitor for the Simman. You can actually just touch the monitor things as you would in one of the patient care units, and the waveforms will come up. As you can see, we have a wide variety of parameters that we can use. And so now I'm going to let the Simman talk to you.
Hello! My name is Simman 3G, and it's a pleasure to meet you. My friends at Laerdal asked me to explain a few of my key features. You and I are going to work very closely during your simulation training. And in a moment, I'll assist you in conducting a head-to-toe examination on me. First, let me ask that you do not bring pens or drinks or photocopies near me. These things can really damage my skin, so I appreciate you not doing that. To get started, please press my radio pulse. Obviously, I can talk, and during our simulation training, you'll be able to ask me about my medical history and other things, like favorite songs and TV shows. Notice there are many microphones in my ears. I can hear everything you say, so please be nice. Do you find it warm in here? I'm sweating. I hope I'm not getting sick. In some situations, I may sweat. I'm counting on you to determine what's wrong with me. When I'm sad or in pain, I may cry. I hope you pick up on my emotion and ask me what's wrong. Uh-oh. What's happening? My oxygen saturation level is dropping. You see the value changing on the patient monitor? Look at my mouth. I'm becoming cyanotic. And I'm also breathing faster. When this happens, I hope you'll take quick action to save me. I've reset my respiratory rate and SpO2 to their normal limits. That feels better. Now, I'd like for you to check out my pupil response. Shine a pen light into my pupils and note how the pupil size accommodates the light. Pretty cool, huh? Click on my carotid pulse when you're ready to move to the next feature. You're doing a great job. Now, let's practice the very important skill of bag mask ventilation. Please locate a bag valve mask device. When you have the bag and mask in hand, I want you to open up my airway using a head tilt, chin lift maneuver. Okay, now I want you to practice ventilating me. I've set my lung resistance and compliance to normal. When everyone has had an opportunity to ventilate me, you may click on my radio pulse to continue. Okay, let's make this really exciting. I've increased the resistance in my lungs. Notice that it is much more difficult to ventilate me. Press my radial pulse when you are ready to continue to the next activity.
Is that harder?
Yep,
Much harder?
it really is.
Hey, thanks for saving me. Again, I've reset my airway settings to their normal value. For a list of compatible airway devices, please review the list displayed on the patient monitor.
So we have ET tube, Combi tube, LMA, and LMA mask trach.
Let's now examine my chest features. First, we'll listen to my heart, lungs, and bowel sounds. All the sounds are set to normal. When everyone's had an opportunity to listen to these sounds, please perform a jaw thrust when you're ready to continue to the next section.
Want to go ahead, Evan?
Sure.
Okay, I've set my heart, lung, and bowel sounds to abnormal. Please listen to me again. When everyone's had an opportunity to auscultate these sounds, you may press my radial pulse to continue to the next section.
Go ahead, Evan.
Okay, let's move on to my ability to help teach you how to do quality CPR. I'm going to set my ECG to something, say, really scary. I'm counting on you to start CPR for at least 20 seconds.
1 and 2 and 3 and 4 and 5 and 6 and 7, 8, 9, 10, 11, certainly can. 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths.
I am alive!
Those
You
breaths.
did amazing work. Thank you. Now please check my femoral pulse. Be careful not to press too hard on any of my pulse sites. It could actually occlude the pulse. When this happens, simply press less firmly. Now remember, please check my femoral pulse, and when everyone's had a chance to check it, perform a jaw thrust. Alright, this is a little embarrassing, but I also want you to know about my external genitalia. You know, it can be configured as either male, female, or none. You may catheterize me, and urine will actually flow into the foot. Okay. That's quite enough talk about my genitalia. Let's move on to my arms. I want to tell you about my blood pressure.
You want to come over here?
No, it's okay. Are you supposed to push on something to get the blood pressure to go?
I don't know.
Yeah, this is bad body mechanics. What can I say?
Let's talk about blood pressure. You may either auscultate or palpate my BP on my left arm. Remember that the BP is a product of cardiac output. So, if the cardiac output drops, my BP may be hard to detect. When my BP drops, it's also hard to measure my pulse oximetry. Please now practice listening and palpating my BP. You may perform a jaw thrust when you're ready to go to the next activity. Okay, let's see how you did. The blood pressure you should have heard is 126 over 84. Please inform the instructor if you heard something much different. Okay, we're almost done with our tutorial. Let me remind you that you can feel my pulse at multiple locations, including carotid, brachial, radial, femoral, popliteal, dorsalis pedis, and posterior tibial. I'd like for you now to take a moment and check. Congratulations! You successfully completed the orientation to my key features. Your instructor will demonstrate other features such as medication administration through my IV port. If you want to repeat this tutorial from the beginning, just perform a jaw thrust now.
Okay, the way that the SimMan records the items that the student is doing is by way of these little RFID tags that we've got on the items here. So, for example, when you put the BVM on the mannequin, it records it up on the screen so that you can see not only that the student is doing it, but how well they're doing it. So, as Evan is pointing to. There are also pre-established IV ports on the mannequin now that allow us to do the same thing with different medications. So we have tags for each of the commonly used medications, and as you push the medication into the port on the arm, it records the medication, how fast the student is pushing it, and the amount that they're giving, so that you can record that as well.